actually tested this at 10 and it was working. So,
No, there-
oh, here we go.
Let us know when you can hear us. You're done with that one.
I can hear you guys now.
Okay,
All
great.
right, cool. Okay, so we're picking up then at the Full Health Commissioner highlights then. The commissioner at this point has not just been posted, but it did end, and I believe that they are reviewing now the documentation of all the people who have applied. There are both boards are represented, legislators are represented, there's other department heads that are represented in that committee. So we have not heard anything formal to tell you, any of you, but that is where they are in that process. One thing we've been working on for a long time, I don't know how much information this group's got, is that there is a security team that is being implemented and being piloted first at Green Street. So at the mental health location, we've identified for quite a while that there's a need for security presence there. And the county is approaching it as a start to building out a centralized security for the entire department. So all of the buildings that see a lot of the community, they're hoping to grow it. So this would be the next location that would receive that, and then so on. DSS already has their own, they privately contract, but downtown especially, there's been a lot more discussion around security. Question?
Have there been issues or incidents?
Yeah, yes. There's lots of incidents in and around downtown area. And it's been going on certainly since prior to 2020 though. It's been quite a while. So we've done some build outs downtown. We've changed the structures downtown. We've made certain glass much stronger than it used to be, all those kinds of things. But to have a security presence there would take a lot of the pressure off of support staff who are then always de-escalating someone. So it is going to look as friendly as it can. This isn't going to be armed security with big badges and things like that. It's going to be more like as you enter, you're greeted by this person. They're going to build rapport with clients and community members as they come in, and then build from there. So the security manager, it's going to be a security manager full-time, one full-time security person, and then a part-time to cover all the hours that are late nights and things like that. So there will be a team of 3. But the security manager starts at the end of the month, and I'll be supervising him with the director of DOER. So because it's our building that's starting, we're coming up formulating planning based on our building, and then he'll build out from there as they hire more people.
Was that coming out of county budget or a whole health budget?
So this was an OTR through DOER, so the Department of Emergency Response. So right now it is out of there. And again, the plan would be to further extend that, but based out of that budget rather than our whole. Any other questions about it? It's a pretty big deal for us that we've been planning on it for 3 years and finally hiring the person that I'm really quite excited about. So, all right. Okay. You've got some other information there. We are doing the build out of the Agile teams, which I've been talking to you all about. That is going to be working as a small technical team to build up some of the interfaces that clients have with our intake processes. Some of that will be starting soon. We have continued those collaboration conversations between programs, and we've been building goals based on that, things that programs can work together on. So that's been meaningful, as a lot of that work has already begun. And let's see, we are doing a significant development amongst our leadership staff, especially. So we've been doing lunch and learns around that. We have a supervisor development regular schedule to train up on the soft skills of leadership, essentially, and build out more of those rather than just supervisory type skills. And we're also trying to expand our use of the tools that we already have, such as Teams and SharePoint. If everyone who's familiar with Microsoft systems, we're doing internal training on those things to try to become more efficient. We've been automating processes, which has been exciting to see actual automation in our department. And then I'll just skip to the last part here, this data part. This is live now, is that right? We were just talking about this data for overdoses. It is live on the website at this point, right? So there is updated overdose data on the website. So if anyone wants to go and see it, this is the time of year it gets refreshed. There's a significant amount of planning coming out of looking at that data that I would not say we're ready to have that conversation right now, but we are trying to make sure that the data comes along with the plan, right? What are we gonna do to address what we're seeing in the data? And also making sure that our partners think this is the right data to pull that really helps them understand what they want to understand. So we're trying to evaluate that data, make sure it's good data, and then form these partner relationships to make sure they're giving us some of theirs too, if needed, because most of ours is back end, and we're trying to get ahead of this data and see it in more real time, rather than just at the time of death, which is not reading too much about it. Any questions about that?
And so, and maybe this is a question for Sam. Can you just remind us, what's the difference between the data, the new data that's being displayed and what it was before? Like when it says, is it just that it's updated or you've changed the format as well of what?
So, yeah, so there's like different sources of data on that. It's called opioid use and resources
Yeah.
page. That it had started with and continues to have New York State quarterly opioid report data. And so that information is updated, approximately on the quarter, once we receive it, and then within like the month following. And then the data that was recently updated is the demographic breakdown of unintentional overdose deaths. And
Is that new data we've never had before
we
or?
posted it last year for the first time, and that's through our medical examiner.
Okay.
Who Whole Health essentially contracts with. And so we have access to that data, which is real time. I mean, not really, because we're only posting it every year though. And so we've shifted. Last year was the first time that we had given a breakdown of it over 5 years, because our county also has a very small number. And so now we've like removed the bottom year, and so now it's still like a 5-year spread though. Yeah.
Okay.
Yeah.
Thanks.
So, and sorry, and I should also say, there's also an existing table about drug-related deaths, which is a little bit more inclusive. That's what we had that preceded the demographic breakdown. And so that is updated approximately every 6 months. So it's like many different timelines happening. But sort of like Jeremy said, it's sort of this ongoing process and discussion with partners as well of like, now it's become a pretty large data set, and just what is most useful, what can help inform decision-making and interventions. So it's, yeah.
Okay, great.
Yeah, to discuss.
Thank you.
Yeah, thanks.
Any other questions for Jeremy? Alrighty, so let's go into our divisional reports then. So Rachel, we'll start with you. Got anything?
Just one thing to add to my report, that our team continues to do measles preparedness, lots of trainings offered through the state CDC, various vaccine groups and things like that. We did a run through of an on-call situation, like if a nurse on call in the evening hours would get a call. And we've had some provider offices asking how to test, what specimens to send, and how to get them to Wadsworth. So we've had a couple trial runs of those kind of situations just in the last week or so. So continuing to do all that kind of work, and happy to answer any questions.
Any questions for Rachel? Okay, I think Sam, Sam, you're next.
I just wanted to mention that this week is Infant Immunization Awareness Week. So reminders, different immunizations on the schedule for infants. And then May will begin Mental Health Awareness Month as well.
And then Jessica's not here, right? So we'll skip her unless somebody has something to add to that report. And then Elizabeth or Liz for environmental health, please. I don't have anything to add in addition to. Okay, any questions for Liz on the environmental health report? All right, let's go ahead and move then. Because I can't to that page. Let's go ahead and move to one environmental health enforcement action. So let's go ahead and put that under a motion to approve as written. have a first, first from Ed and a second from Ravinder. This is a hot holding violation. Is there anything that needs to be, it's pretty straightforward. Any questions from anybody in this? All in favor to approve this written? That's unanimous. Okay, I'd like,
I'd like to make a motion to go into executive session, please.
and for the purpose of discussing, litigation. Yeah, top line.
For the purpose of discussion location.
Litigate.
Oh, litigation. I was like, okay, litigation, yeah, okay.
Right, let's go ahead. That's a motion for the second. And then all in favor, sorry. Yes. All right, so we're gonna go ahead and excuse the staff, who are.
We need to keep Polly on. Yeah.
We need to keep Holly. And we need to keep Liz.
Thank you.
Thanks.
Just clarifying, do you want me to fully end the live stream?
Yes, could you
Yes.
please?
Yes, I'll do that.
Nothing in the packet there.
There's nothing in the back.
No.
Yeah. And
The
then.
recording as well.